Hello, my name is Zara and today I'm going to show you the workflow for the administration of medications with the implementation of Pyxis. When a medical officer has reviewed and ordered any medications for the patient, it is their responsibility to communicate this with the treating nurse.
Oh, hi Zara.
Hi.
Great timing. I've just ordered some endone for Mrs. Jones. Would you mind giving it to her?
Sure.
Thanks.
First, the nurse must check the order and allergies on the IEMR at the bedside. The nurse then attends the medication room to dispense the medication from the Pyxis med station. 2 nurses are required to sign for the removal of a controlled medication. In the PA emergency department, the witnessing nurse must be triage competent. Once in the medication room, the nurse logs into IEMR on the PC beside the Pyxis machine. They will select the correct patient record and open the MAR. Both nurses should check that it is the correct record. To log into the Pyxis med station, the non-triage competent nurse enters their Novell ID. They are then prompted to place their finger on the BioID fingerprint scanner. The patient is searched for using their UR number. The nurses must ensure they select the correct patient. Press Remove to open the order profile page. Once in the patient's medication order profile page, the nurses will review the details of the medications they wish to remove. The MAR is always the source of truth, so the nurses should be frequently referring to this during the dispensing process. Once the nurses confirm the order details are correct, they select the medication. The nurses will then select Remove to remove the medication. Because endone is a Schedule 8 medication, the med station will prompt for a nurse witness. The nurse witness will type in their Novell ID and either their password or scan their fingerprint. The Pyxis drawer and QB pocket inside will open. Together, the nurses do a blind count. The blind count is when the nurses are prompted to count the stock currently within the QB pocket prior to removal. One of the nurses will dispense the number of tablets required into a medication cup, return the remaining sheet to the QB pocket and gently close the drawer. The nurse will always sign out of the med station before leaving the room. Once the nurses have returned to the patient's bedside, they will open the correct patient's MAR. The nurses will perform the rites of medication administration. The primary nurse completes the medication administration task in the MAR. Before leaving the room, the nurse taps off the computer. If you encounter any issues with your Pyxis med station, please refer to your PAED Pyxis support documentation.